everyone, today we are going to learn the last part of injuries, the introduction of soft tissue injuries. First, what is soft tissue injury? It is an injury caused by a variety of violence or chronic strain and other causes. The concept of soft tissue in TCM is relatively broad, including skin, subcutaneous tissue, fascia, muscle, tendons, ligaments, articular capsule, articular cartilage, etc. We will study the etiology and pathogenesis of soft tissue injury. The etiology of soft tissue injuries also includes internal facts and external facts. This is the same as fracture and dislocation. First, by the form of violence, they can be classified into sprain, contusion, and grading contusion. Sprain refers to the injury caused by indirect violence that causes the limbs and joints to suddenly have activities beyond the normal physiology range. It is common that there will be a muscle pain injury at the waist when we handle heavy items and raise our waist. Sprain of ankle joint is common when walk in an inappropriate posture. The second is contusion. Contusion refers to the injury of such tissue as skin, fascia, muscle, tendon, and other tissue due to direct violent blow or impact during falling down, heavy object extraction, and other effects on the human body. It is commonly caused by collision between the limb and the vehicle door or other parts of the vehicle due to sudden braking in the vehicle. The third is grading contusion, which refers to the serious injury of the skin. Deep tissue due to squeezing of the limb by the moving or rotating blunt object. Grading contusion is likely to result in local infection and necrosis. Second, by the degree of soft tissue injuries, they can be classified into laceration, rupture, and soft tissue dislocation. Laceration is a tearing injury of fascia, muscle, tendon, ligament, and other soft tissue due to the action of violence on the limb. Rupture is soft tissue rupture in which the soft tissue is completely ruptured. Common ruptures include Achilles tendon rupture, etc. Another grading contusion is soft tissue dislocation. Clinical common grading contusion include disorder of small joint of the lumbar. Finally, by the cause of soft tissue injuries, they are classified into acute soft tissue injury and chronic soft tissue injury. Acute soft tissue injury is a new injury of not more than 2 weeks caused by sudden violence. Generally, there is an obvious history of trauma. Chronic refers to the injury of soft tissues caused by inappropriate work and rest, incorrect posture. It often occurs at moving joints and weight-bearing joints such as cervical spondylosis and lumbar disc herniation. Next, let's have a look at the diagnostic points. First, the main symptoms of soft tissue injuries are similar to fracture, including pain, swelling, and dysfunction. But soft tissue injury have their own characteristics. The early pain is more intense, with local swelling appears rapidly after 2 to 3 days. The swelling gradually decreases and local dysfunction gradually occurs. After 3 to 4 days, blood stasis gradually disappears. Swelling is partially subsided, with the color changed from blushing purple to yellow. 2 weeks later, the stasis and swelling are partially subsided, and the color of the ecchymosis turned yellowish brown, and pain is also gradually decreased. About 3 to 5 weeks later, all symptoms may disappear. Apart from local symptoms, soft tissue injuries will result in various complications. Common complications include tear of small bone fragment, nerve injury, traumatic ossification, cartilage in the joint, osteoarthritis. In the process of diagnosis, modern medical techniques such as X-ray, CT, MRI, and other examinations shall be combined to help confirm the diagnosis. Next, we will talk about the treatment of soft tissue injuries. The treatment principle of soft tissue injury is same as fracture. Commonly used treatment includes soft tissue manipulation for patients with severe soft tissue injuries of the joint of the extremities. The soft tissue manipulation cannot be used immediately until the swelling subsides. For severe soft tissue injuries, although displacement is not likely, like fracture dislocation, but appropriate fixation can also be given to prevent the aggravation of injury. It can also relieve spasm and reduce pain. The common fixation methods include bandage fixation, elastic bandage fixation, adhesive fixation, wood split, and plaster fixation. Of course, function exercises is necessary to accelerate the rehabilitation after fixation. Also, we can adopt acupuncture treatment which can efficiently relieve the symptoms. For some severe soft tissue injuries, such as tendon and ligament ruptures and articular cartilage disc injuries, surgical treatment should be performed as early as possible to avoid complications. Above are all the introduction parts of soft tissue injuries. We have learned the introduction of disease involved in the complete injury part, and in the next class, we will study more about injury. See you next time. Thank you.